I'm Priyash Patel, grew up actually in London, England until the age of 10, moved to Chicago, went around to a bunch of different places interviewing for residency and fell in love with Vanderbilt, came here for residency, and then went away to Stanford for a year for a fellowship in facial plastic and reconstructive surgery, and then came back here to Vanderbilt where I am a assistant professor in facial plastic surgery and then also spend time at the VA.
My name's Irving Basañez. I'm actually from Mexico. Grew up in South Texas and came here for residency. I was here for 5 years and did a private practice job for a year before deciding to move to the VA here where I trained. I actually got to work with Dr. Patel here when he rotated through the VA. I was his senior resident on a few rotations. The pediatric service, and we've been friends ever since. I think the VA experience has something for everyone. So it has something for the intern that's never touched a microscope before and is learning how to clean ears. It has something for the PGY2 who is still working on their diagnostic skills and physical exam and just the nuanced parts of examining the head and neck, and even learning simple surgery like laryngoscopies or even simpler ear procedures. And then it has something for the chief resident. They are learning about coding, they're learning about clinic flow, they're learning about how they will in the future want to run their operating room. We are teaching them the skills of doing in-office turbinate reductions, in-office balloon sinuplasties. I know Dr. Patel and we've done some procedures before when he was a resident, and he's going to be there as well to help expand that program, even in the facial plastics world.
One of the best parts of having a VA hospital as part of your residency training is the fact that there is a lot more autonomy. And that's not to say that attendings aren't available and don't teach. It's more so that the residents are almost asked to take on that sort of leadership role. We have a chief resident who's in their 5th year of residency, really running the service. And then they will have a more junior resident in addition to an intern many times who are learning directly from that chief resident. And that chief resident, when we're in the operating room, has the opportunity to teach the younger residents directly while we are overseeing the procedure, which is rare relative to your experience here at Vanderbilt, because residents generally have more of a one-on-one interaction with an attending here. There's not multiple residents in an operating room, and there's not even multiple residents within a single clinic. Whereas at the VA hospital, you do have that interaction with your chief resident and junior residents, and you're almost forced as a chief resident or senior resident to be able to run a service by yourself, make plans by yourself, and then teach those things to your junior colleagues.
Yeah, I think during not work hours, I would either be at Priyesh's house or come over. So we still hang out with the people that we work with. I think that's a testament to how the strength of the relationships that you make in residency and at work. You don't go home and say, God, I don't want to see those people for another 12 hours or the weekend. You actually hang out with each other outside of work, which I think speaks volumes.
And it wasn't just me and you, it was that we had half the residency, we would all just go out and have a good time. And we also made it a point that, and I know the residents still do, to have relatively frequent events where you can spend time with each other. So there's so many different opportunities, both in work and outside of work, for us to bond, and we definitely take those opportunities.
It's a very rewarding experience. It's very different. It's not a private practice job, but there's also a lot to learn from teaching. So now we're back at the VA and we're back working together, and that's kind of speaks to the kind of relationships that you make when you're here at Vanderbilt. I think it's probably one of the biggest strengths of the program. You can get good training most places you go to, but to really feel like you're part of a family, that's something that I was seeking out when I was an applicant looking for residency programs.